So coming to the other section of the pons. So this is at the upper part of the pons where the nuclei of the trigeminal nerve will be appreciated. So this is the section of the pons at the upper level. So this is the ventral part and this is the sulcus bacillaris where the basilar artery will be lodged. So this is the middle cerebellar peduncle which is going to connect the pons with the cerebellum. Then posteriorly, so this is representing the superior cerebellar peduncles. So these are the superior cerebellar peduncles which connects the cerebellum with the midbrain. So the two superior cerebellar peduncles will be joined by means of what is known as superior medullary velum. So this is representing the fourth ventricle. So the cavity of the fourth ventricle, the two superior cerebellar peduncles which are joined by the superior medullary velum. Coming to the rest of the sections. So here it is representing the various components of the lemniscal pathway, that is medial to lateral, medial, trigeminal, spinal, and at this level you are going to appreciate the lateral lemniscus also. So medial lemniscus, trigeminal lemniscus, spinal lemniscus and the lateral lemniscus. And in the most ventral part, the rest of it. So the anterior part, as already mentioned, it is forming the basilar part or the pons proper. The posterior part will represent the tegmental part. So the rest of the basilar part shows the transversely running fibers of the pons. So these are the fibers which are seen horizontally running in the basilar part. Then coming to the tegmental part. So in the tegmental part, so this is section of the central tegmental tract. So this is central tegmental tract, and trigeminal lemniscus is also considered as ventral trigeminothalamic tract. So there is one more, dorsal trigeminothalamic tract on the posterior aspect. And in the medial part, so this is medial longitudinal fasciculus and this is the tectospinal tract. And the rest of it, as I already mentioned, various nuclei of the trigeminal nerve. So coming to the nuclei of the trigeminal nerve, so at this level, medially a small motor nucleus of the trigeminal nerve and larger principal or main sensory nucleus of the trigeminal nerve, and in the upper part this is the mesencephalic nucleus of the trigeminal nerve. So the trigeminal nerve with the three components of the trigeminal nerve of thalamic, maxillary and the mandibular nerves, and this is representing the trigeminal ganglion. So these are the fibers of the trigeminal nerve, which is the fifth cranial nerve. And one more nucleus which is appreciated at this level. So this is called as the nucleus ceruleus. So this is the nucleus ceruleus of the locus ceruleus. It is said that it is rich in noradrenaline and it is representing a part of reticular activating system, and it is basically concerned with the paradoxical sleep or REM sleep. So paradoxical sleep is the one which is said, which is paradoxical in nature, contraindicating with the active mind and a sleeping body. So this is the diagram for the section of pons at the upper part of the pons where the trigeminal nuclei are represented. So the main difference here is amongst the lemniscal pathway, the lateral lemniscus is also present at this level and various nuclei of the trigeminal nerve are appreciated at this level. This is the section of the brainstem. So this is pons. So in the pons, this is the middle cerebellar peduncle which is connecting the cerebellum and the pons. This is the horizontal sulcus or the lower border of the pons. So this junction where the pons, the cerebellum and medulla oblongata meets is called as the cerebellopontine angle. At the junction, this is the basilar sulcus which is appreciated in the ventral part of the pons. So that sulcus is for the lodging of the basilar artery. At the junction of the middle cerebellar peduncle and the pons, these are the fibers of the fifth cranial nerve, the trigeminal nerve which is emerging. In the posterior surface, this is the superior cerebellar peduncle which will be connecting the cerebellum with the midbrain. And the two superior cerebellar peduncles are joined by means of the superior medullary velum. And this will be the floor of the fourth ventricle, and this prominent bulge which is appreciated is the facial colliculus. So the facial colliculus which is formed by the looping of the internal genu of the fibers of the facial nerve across the abducens nucleus. So this bulge is the facial colliculus. So out of the two sections of the pons, one was the section taken at this level, that is the facial colliculus, and the other section is at the level of the upper part of the pons. So that is at this level where the trigeminal nuclei are appreciated.